Good morning, everyone. Early morning, and welcome to the ETUC Conference Blueprint for Equality. We are now starting panel 14 and are here to discuss work-related psychosocial risks and health inequalities. My name is Paula Franklin, and I work as a senior researcher at the ETUI on occupational safety and health and working conditions, and I have the pleasure to chair this panel. Now, just a few words about work-related psychosocial risks, or PSR, as we also know them. So these are related to how work is organized. So firstly, these are not to be confused with stressors in people's private life. So we really talk about here the world of work. Now, these risks are not covered by a dedicated EU-level directive, and research shows that the legislation of psychosocial risks across the member states varies considerably. And therefore, we can also see that workers are not equally protected across the EU. The situation is, of course, unfair. So we're talking here about an example of structural inequality. That also leads to health inequalities. This inequality in terms of worker protection and health outcomes also hinders the sustainability of societies at large, in that exposure to these risks makes workers ill, which is costly for social and economic costs. So it's costly for the workers, their families, employers, and the healthcare systems. Now, this morning we will hear details and new research findings about the differences in the situation in terms of work-related psychosocial risks between European countries and between different groups of workers. And then we will focus really on what has to change. First, we will have a pre-recorded presentation by Professor Hélène Sultan-Tayeb from Université du Québec à Montréal, where it is now 3 o'clock in the morning. Hélène has prepared a fascinating insight for us based on her very recent and still ongoing research into differences between European countries on illnesses that are caused by work-related psychosocial risks, and also how much does this situation cost for the countries. So first we are looking at the differences and inequalities between countries. After Helene, we will go to University of Düsseldorf in Germany, from where Professor Nico Dragano will join us to tell more about the exposure to psychosocial risks and the related health inequalities between different groups of workers in Europe. And this is based on his ongoing research, so new research as well. So he will provide us a slightly more granular view into the situation. Once we have established the extent of the problem with work-related psychosocial risks and health inequalities, we move on to address the core question of this conference, which is what should we do about these inequalities? Professor Meri Koivusalo from Tampere University, who is here with me this morning, will give us some food for thoughts in terms of the current global and European context that gives rise to the work-related psychosocial risks, as well as the critical conditions that require urgent addressing. She will be focusing on the policy level in relation to psychosocial risks. And after the three presentations, we invite Aaron Reeves from Oxford University to take the floor in response to the research findings and presentations. We are very, very pleased to welcome all these speakers to our conference, as they are indeed very experienced and knowledgeable in their respective research fields at the European and global levels. But because it is important to have collective reflection on what actions should be taken in order to prevent and mitigate the inequalities in the exposure to PSR, we very much welcome your questions and comments. So the lines are open. So if you are participating via Zoom, please post your questions to the Q&A box. I will be keeping an eye on that. And for the audience here with us in the room, you can actually use the raise hand function. It works here. But now we'll start with a pre-recorded 20-minute presentation on the disease burden and costs of PSR by Professor Hélène Sultan-Tayeb, who does research in evaluation of preventive interventions in occupational safety and health, including the implementation process and cost-benefit analysis. And she also researches economic evaluations of the costs of disease due to occupational exposures. So what you are about to hear are brand new research results, 11.4 billion per year, just as one health outcome, and limited number of risks. So I think we can really start talking about a tip of an inequality iceberg here. Also, what we can see clearly from the research is that work-related psychosocial risks lead to years of life lost, which means premature death. And this is an important point to highlight in the context of the EU strategic occupational health and safety framework that is actually aiming for the zero vision for work-related deaths. So not only to look at the workplace accidents that are highly important to prevent, but also to expand and think psychosocial risks in this context. Now, let's move on now to Nico Dragano, who is a professor for medical sociology at the University Hospital Düsseldorf in Germany. His main fields of interest are psychosocial risk factors at work, digitization and health, health inequalities, and healthcare inequalities. Nico has a long-standing expertise in conducting investigations on the interrelation of social and biomedical factors using large data sets from population-based studies. Please, Nico, the floor is yours for about 15 minutes.
Thank you very much, Paula. Can you hear me?
Yes, very well.
Good morning, everybody, dear colleagues. I'm sorry that I can't attend personally as I am at another conference here in Germany, so I have to give the presentation online. I will now share my slides. Does it work, Paula?
Yes, you can click to the presentation mode.
That's nice.
Now,
so I will talk about a project where we analyze data about work-related psychosocial risk factors as possible drivers of health inequalities, as we are here in Germany mainly doing occupational epidemiology. I will start with a short introduction of the major problem, and I start with a landmark study, Michael Marmot's and colleagues' publication from 1978 on health inequalities in workers. It's a Whitehall study, and you see rates of coronary heart disease by occupational position, and you see a steep gradient. The higher in the hierarchy you are, the lower are your coronary heart disease mortality rates. So this relates directly to the colleague who spoke before. I guess this gradient was evident even before that year, but this publication was very important for the field. From then on, we have several other studies who showed that this gradient persists or even widens until now. So how are the mechanisms behind this gradient? I like to use the model of Clougherty and colleagues, which we have modified slightly, which gives an overview about the possible pathways from your occupational socioeconomic position to your health and, in the worst case, to your mortality. And we know it's a complex thing, and it's more accumulation of risks than a single pathway. And Clougherty argues that before occupational inequalities emerge, something happened before, because in the life course, children from lower social class families are selected into lower occupational class jobs. So they already have their burden, and we know that poor children, for instance, have worse health, and that poverty in childhood influences health in adulthood. So there's something which already happened before entering the labor market, and education itself has an independent effect on health. That's the first pathway. The second pathway is that a low occupational position is related to low payments. And we know that low income is one of the major medical risk factors for premature disease and death, because it relates to many of the social determinants of health. But now we enter the world of work, and work itself could also have a contribution. And that's the different exposure mechanism. That means if you have a low position job, you're exposed to more psychosocial and physical risk factors, which then leads to a higher rate of disease and mortality. And the last pathway is effect modification. That means that when you already have a low position, your health is already deteriorated, and then you face work-related risks, then you have a higher probability to get sick while facing those hazards. We looked specifically on the differential exposure pathway in this project, but we know that there are many other pathways. So we don't think that a differential exposure with psychosocial risks explains everything, but it may be an important pathway. So our focus is on path 3, on differential exposure. And what we tried to gather is recent data, because we have studies on that issue. We know that certain psychosocial risks are distributed unequally, but more recent studies from Europe are missing. And we also wanted to have a look on temporal trends, because world of work is fastly changing, and so are types of inequalities. So we have new forms of precarious work. Think of the gig economy. So the old concepts of occupational position, occupational class, or qualification, I guess they are still valid, but there are new dimensions of inequalities at the labor market. Therefore, we also wanted to measure occupational inequalities in an intersectional way. So we included several indicators of vertical inequalities, so the classics, education, occupational class, but also employment conditions like temporal work or multiple jobs, and combine that with horizontal markers, indicators like age, gender, and migration, because we know that both factors may interact. We included several domains of psychosocial risks. Many of them you have already seen in the presentation of my colleague before. And we use data from the European Working Conditions Survey from the waves 2010 and 2015. And we use recent data from Eurofound's Living, Working, and COVID-19 survey. Here you see the numbers, so we have a large number. All those surveys are cross-sectional, but you can analyze them as kind of a trend study. I won't go deep into the methods. I jump into some preliminary findings to give an impression what we see in this recent European data. And I start with the main idea of the differential exposure pathway is that when you are low in the occupational position, you face a higher burden of psychosocial risks. And the example I show you here is job insecurity. Here you see the results for both ways of the EWCS, and here from the COVID wave, which was conducted in April 2020. And here you see this intersectional classification. So here we look at the interaction between low education and gender. These are men, these are women. And we also looked at age differences. This is a probability of feeling job insecurity, an established stressor. And here you see a gradient, which means that the probability that you have job insecurity is higher when you have primary education, both in men and in women. And the proportion is lower in those who have higher education. So that's a nice example for for a gradient in psychosocial risks. Things get a bit more unclear during COVID-19. We see a very pronounced gradient in young women, but in other age groups and for men, we see that inequalities get smaller, and we even see kind of U-shaped distributions. So inequalities narrowed a little bit during COVID-19, with the exception of young women. Now, another example, I guess it's important to highlight this. It really depends on the psychosocial risk we look at. When we look at other kind of risk factors, and this example is insufficient time to get your work done, so high psychosocial work demands, we see a reverse gradient in both sexes. So for men and for women, we see that those with higher education have more time pressure. And for this indicator, the gradient is not very large in the earlier waves, but get a bit more pronounced during COVID-19. Now I come to health. What does that mean for health of the workers? First of all, let me show the trends. We used the WHO-5, which is a tool to measure mental well-being. The range is from 0 to 100, and you speak of low mental well-being when the score drops below 15. And here you see the prevalence of those with very, I made an error here, of those with very low mental well-being. In the 3 ways, we start with 20% bad mental health in 2010. Then it dropped a little bit, it improved a little bit, but then with COVID-19, it nearly doubled compared to the first EWCS. So we really measured an impact of the pandemic, which was a mental burden for nearly 40% of the European workforce. Now the core idea is to say, okay, we have inequalities in health, and we looked at inequalities in mental health. That's what I show you now. These are multi-level regression models, and they show you the results of the first 2 waves. I tell you why in a minute. More than 60,000 observations, and what you see here are the estimate from those regression models with a well-being score with different markers of inequalities. And here you see some kind of new inequality markers, which is a temporary contract, so insecure employment conditions, multiple job holding, and here's a classic indicator, education, secondary compared to tertiary and primary to tertiary. And here you see the estimates, and that means a minus means that those with primary education have a considerably lower well-being score than those with higher education. So it's a gradient. And interestingly, we also see it for temporary contract and multiple job holding, which in itself has a strong effect. This model is controlled for age, sex, household size, and some other indicators. And now we controlled for the working conditions. It's an old-fashioned way to see if there's mediation. I know it's not perfect. We can discuss that later, but it's a preliminary analysis. And if the estimate reduces when you introduce those working conditions, it may be that they mediate the effect. And we see that for temporary contract and multiple job holding. So the estimates drop. So it could be that differential exposure plays a role, but not for education. The estimates were more or less comparable for the COVID wave. Therefore, I showed this one because the estimates are more precise because the number was higher. Now, the last finding is there we look specifically at this idea of intersectionality. So how does gender, for instance, age, and psychosocial risks act together to explain deteriorating mental health? And these are the results of a three-way interaction. There you see the combined groups in the different ages. And what we found here, we found an indication for an interaction in young workers for both men and women. So those with temporary contract had considerably lower mental health scores. So there's a real huge difference. And we saw that it improved when those workers got a long-term contract. This is very preliminary, so I won't go too deep into that. So the first summary is that, first of all, mental well-being dropped substantially during the pandemics, but in some subgroups, especially in women with low education, it really decreased pronounced. So we got some high-risk groups. Health, we saw health inequalities for all indicators of socioeconomic positions, but with different strengths. And we saw variations in inequalities and psychosocial risk factors. We have some indication of multiple deprivation regarding bad working conditions in the last slide, but it's really work in progress. We have conducted several other studies on that issue. We can broaden the scope and the discussion a little bit. And the analysis has methodological limitations, so cross-sectional, and it's not a formal mediation analysis, but it gives an impression of what happens in contemporary Europe regarding health inequalities in workers. Thanks a lot for your attention.
Thank you very much, Nico. Your research findings, even preliminary, make it clear that there are inequalities between workers in terms of exposure and also the health outcomes, and that we should really focus particularly on the situation of young workers and let's say low educated women workers in this context, so that psychosocial risks are distributed unequally, and the new forms of work, the changes in the world of work are actually increasing psychosocial risks for many different types of worker groups. But now that we have a clearer idea of what it is that we are talking about when we are talking about work-related psychosocial risks and health inequalities, let's take forward the thinking about the program of action and the policies towards more equality in the world of work and protection from psychosocial risks. And for this, we invite Meri Koivusalo, who is a professor of global health and development at Tampere University, with expertise in global and transnational health and social policy, trade, and global governance for health. In addition to academic research, she has worked with the Finnish government, European Commission, World Health Organization, and many international non-governmental organizations. So please, Meri, the floor is yours for about 15 minutes.
Thanks very much. I'm really chuffed to be here. And now we are having the hardest thing in the session, which is getting the slides to work. Hopefully hardest thing, but
You have to get closer to the mic so that you can hear you.
okay. Could I get the first slide, please?
Yes.
Okay, so I'm going to go on the psychosocial impacts at policy level. And this presentation brings together some of the work that I've done in terms of health inequalities and European policies, globalization, trade, and now at last our project on platform economy and interviewing both kind of platform economy workers and people who have been involved in regulation. So I just want to kind of bring up something for the discussion rather than we put evidence directly to kind of draw what does that kind of imply for trade union movement and how to kind of gain perhaps a bit more kind of joint agendas with the kind of a broader, wider kind of efforts now work on with the health inequalities and well-being economy that has been put on the European agenda. Can I get the next slide? This.
Yeah.
Oh, okay.
Jump into action.
Okay, so my kind of point will kind of address the kind of the big wheel, the kind of a society wheel. And the aim is just to kind of say that we kind of do efforts in terms of the kind of improve the control work, to kind of improve the kind of rewards that you kind of get, to kind of improve the or diminish the psychosocial stresses on work and health, as well as to kind of focus on the society measures in terms of protective policies. But at the same time, there is a kind of a sense in much of the policy measures that you do these kind of little wheels, while the big wheels tend to turn within the societies and imply much larger implications, and then what we can catch in the kind of research or through the kind of work at the moment. And I think that has been kind of drawn in the inequality research, health inequalities, by Wilkinson and Pickett, on talking about status anxiety and inequality. But now increasingly a number of researchers are talking about systems, about macro social determinants of health and employment as part of the kind of a wider picture. And I would put part of the kind of challenges in terms of the globalization, the politics, what we see maybe called as the new normal for the health policy, but also for the public policies, and the ways how we kind of see the operational framework of the kind of public services to change in the context of outsourcing, competition, and more managerial reforms. At the same time that you've got a framework driven by more individual choice and high requirements for regulatory action. I think better regulation is widely known as a kind of a challenge for kind of a labor movement in terms of both the aim as well as the kind of actual EU measures under the name. And in the end of the day, I think that what we see is that in the governments who wish to kind of improve working conditions, who wish to kind of get something new, invest in innovation, they invest in digitalization, they look forward in kind of gaining further resources through that. And I think that you heard yesterday already great kind of presentations on the digitalization and working life. But I think that it also implies at the moment the kind of a position of transnational corporations, which is kind of a much more prominent than it used to be because of the kind of a role that they can have. And where the interest then kind of focus much more at EU level and not necessarily at country level discussions. And I think that kind of puts the kind of a trade union movement in a kind of a crucial situation in terms of shaping the situation for the future. From the health policy side of the observations, employment and working life has been living quite low life, and much more emphasis has been put on the individual lifestyle factors. It's not the work stress, but it's the smoking, the alcohol, and related behavioral choices which are emphasized. And I call it that it's kind of the Munchausen's challenge of health policy. And Baron von Munchausen was known for kind of his kind of fabulation of stories. And one of them was that he was able to pull himself and his horse up from a marsh by just pulling his hair. So the kind of overemphasis of the individual empowerment also kind of has the downside that you enable shifting the risks to individuals, and you enable also kind of changing the kind of issues of working conditions and occupational health and safety to kind of a corporate well-being markets of products that you kind of can engage with. And then if you kind of think about globalization, then you think about kind of individualization, and then you think about the kind of a coming age of the pandemics. And I haven't even added the war yet here. So the question is what and how can governments and public policies prepare better to the kind of a collective challenges that you might have or are likely to have, and which are likely to increase inequalities. We know that crises increase inequalities, and we also know that very often recession, economic crises, and their aftermath increases social inequalities. So one of the kind of factors is within the societies, but I think that it's also putting changing context to the public sector work, and the ways how different participants of the problem are contributing to the solutions and are rewarded from the solutions that they are. And I've been kind of looking particularly, for example, the pharmaceutical industry and the relationship of rewards to the pharmaceutical industry for innovation. And when you think about the nurses taking the risk and the doctors and the rewards that are likely to kind of result. So there is a kind of a issue between the public and the private sector in terms of kind of relating to the kind of problems. And I think that is somewhere also a bit at the core of the problems. And this also kind of relates to the role of the platform economy. And I think that it is because digitalization is, I don't know if Finland is the only country, but I think that in many countries, digitalization and technology is seen as the kind of future. It's seen as the means for innovation and scope to kind of provide new work, new kind of employment, new kind of scope in the future. But yet what we have seen has not really realized it, or has it? What we've seen is something else. And I just kind of, I want to kind of bring up a different perspective than the kind of digitalization technological, but in terms of the politics of platform economy and what kind of a societal actor we might kind of see in that. In terms of the psychosocial stresses, I think that the stresses in platform work are similar, but also slightly different to the other stresses in work. Some of them kind of relate quite closely to the stress in the employment, but I think that there are issues which relate to the flexibility of when to work, but less when you are at work. The discrepancy in terms of power to disconnect by the kind of contractors and then the corporation, the contractor responsibilities, shifting of risks to the individual. And even in the kind of countries where, like Finland, you actually have got a quite substantial 30% of savings from social protection costs to kind of, if the person is working as a private contractor. And you've got the removal of managerial level posts. You've got fragmentation of work to services task. And you've got also for the actually kind of workers in the platform economy, the time spent on waiting, looking for work without paid, or looking for services, kind of gigs, which is kind of stressful in itself. While it's not even kind of something that it's related to the employment, but not employment itself. So I'm going to kind of put up 5 kind of claims of the kind of why the platform economy in itself is kind of a wider concern of the trade union movement. It's not just the careers, it's not just the kind of self-employed, but kind of a wider context. And many of you are well aware of the current directive on employer-employee status, and I'm not going to talk about that. My point in here is that some of that discrepancy is inherently related to the kind of importance for the kind of companies to kind of operate under the business model commercial law. That's the preference. And it is important that they want to see the contractors as contractors under the commercial law rather than kind of at national level. And I think that is kind of a part of the kind of a social regulation, which sometimes kind of gets missed in the context of debates because it's kind of not there upfront. The second is the politics of tech and innovation services, about framing yourself as the future, not the past. And what the services again and the innovation again relate you to is they relate you to the trade policies. They relate you to the kind of a commercial policies and relating and seeing that as the kind of a core feature of your action. So I think that there is a kind of importance to know how the kind of platform economy operators, how they frame it. And it's also because this kind of measures, what the platform economy has got potential to kind of be wider as a means to avoid employer responsibilities in a wider sectors of society, as through outsourcing, through kind of a different ways of providing work and relating to it. So I think that it might kind of look at the kind of a not that good for Uber or DoorDash at the moment, but there is kind of lessons to be that lot of wider kind of actors have learned and which can be kind of applied. The third issue, what you can see in terms of the platform actors, is very much the kind of a private oversight, that they work in the private sector, they work in the kind of a voluntary insurance to their contractors, to the kind of self-employed. There is this sense of reactionary measures, while most of the kind of companies seem to be kind of dealing with what are kind of legal cases and complying with the legislation. You still have got a lot of the kind of corporate charity and PR emphasis in terms of the way how social protection is addressed and how social issues are addressed within the companies. And you also have got something that I find emerging, but not yet there, which is the social security as a market-based service, much more than before. And while you have got scope to kind of expand social security through platform economy, because you actually register so much data and work hours, so you actually could have that scope. What you are offered is these deals and public-private partnerships with the kind of insurance companies, and the question is, to what extent there is a kind of a danger that we are actually creating an industry of social protection as part of the kind of response to the kind of concerns. And I think that the last thing is that our friends in the platform industry are not that social responsible actors as one might think about. So when we have a kind of a digitalization and platform economy promoted as a kind of a core future for EU policies, and then we need to kind of think about how these kind of operate as corporate citizens, and to what extent we can kind of see a lot of tax avoidance done and a lot of transfer pricing because of the transnational nature of the corporations. So you see that they are kind of moving taxation to the kind of countries where that's the most kind of feasible to have. And I think that this is all old news for a lot of our trade union membership. But I think that the combination of the kind of a way which platform economy is seen as the future, and the way how it relates to the working life is crucial. And I'm going to go now to the end to kind of discuss some other kind of aspects which relate to health and health inequalities, and the way where we also kind of might need some of the kind of maybe kind of a trade union attention to the emerging focus on the health in all policies, or what you call well-being economy within societies, which is coming from the health promotion movement, and which is coming from kind of a concern of health inequalities, but which tends to lack a bit bite in terms of the regulatory frameworks and understanding where and how kind of a politics emerge. And in here, I think the challenge is especially the kind of the purple round of this figure, the politics that shape the employment conditions, the politics that shape how kind of and what kind of a regulation governments can take further to kind of address social protection. And so in terms of the EU policies, from the health side and from the health inequality side, there's been kind of a focus on the health in all policies to kind of call accountability of EU other policies to kind of address social determinants of health, and to kind of look at health inequalities at the level where kind of structure changes take place. And there I kind of think that engagement from the kind of a trade union movement would be kind of useful in terms of the emerging kind of a focus. And I think that the future will be in terms of how the rules of the game are shaped in the EU. What will be the kind of driving priorities? And one of the efforts to change that has been the kind of the focus on the economy of well-being. Not to say that, you know, economic growth is the priority, but you have to kind of prove that the economic growth and how you gain that is worth it. It's kind of that the impacts on health and well-being are kind of relevant. And there is a kind of in the 2019, the Finnish kind of government took that on the kind of EU agenda, but they didn't take that in terms of the employment, which is kind of interesting, that there is a lot of focus on healthcare, there's a lot of focus on education, training, gender, and social protection, but the kind of contribution of well-being at work, which is kind of increasingly recognized now as kind of important part of the well-being, has not really kind of got into the kind of a wider consideration, even though in the actual European Union Council conclusions, there is this kind of specification of work. There is a kind of emphasis on employment, active labor market policies, and occupational health and safety as part of the broader economy of well-being approach. And while this kind of has the danger of being woolly and nothing to kind of gain, sometimes it is kind of important to kind of achieve the kind of a woolly and politics of broader context, to kind of be enabled to articulate them in the forums where the kind of policies are done, and where the EU priorities are set. So thank you. If you want to read more from our actual study, that's on we've got some kind of contributions on the kind of area on the BBWWW platform economy and I also thank my kind of colleagues and co-workers for this. Thanks very much.
Thank you. Thank you very much, Mary, for presenting somewhat complex systemic issues in a very enlightening manner. So it really appears, or is very clear, that in addition to working conditions at workplaces, we should also be thinking about and addressing poor employment conditions, because these are actually interrelated. So your occupational health and safety at your workplace also relates to your employment conditions. And I also picked up that it's clear, we know that we have collective challenges, but at the moment, some actors are pushing only individual solutions and shifting the risks and costs to the workers. So this is a trend that we are picking up, and this is a trend that it's going definitely to the wrong direction in terms of tackling inequalities and having sustainable societies. But now I will turn to our discussant, Aaron Reeves, who is an associate professor in the Department of Social Policy and Intervention at Oxford University and a visiting senior fellow in the International Inequalities Institute at London School of Economics. So Aaron, what are your reflections on what we have heard about this morning, and what are the elements you would bring into the blueprint for equality that we are exploring? Please, Aaron, the floor is yours.
Thank you. And now, mindful of wanting to give time to questions and discussion, I'll take just a couple of minutes and want to thank ETUI and ETUC for bringing these speakers together, for creating this conference, and also to apologize for not being able to be there today. I was really keen to come and meet with you all, but there is, as you may know, a large strike happening on the trains in the UK, and I wanted to express solidarity with them. But unfortunately, that also meant that I was unable to be there. I want to offer just three very brief reflections. One actually connects very directly with what Mary was just talking about around well-being economy. The World Health Organization are currently developing a line of work that's explicitly trying, I think, to address some of the criticisms of some of the discussions around well-being economy that Mary rightly mentioned. Sometimes it has lost some of that regulatory or political bite. But what some of the discussions that are happening within the World Health Organization, within the European region, are trying to do is to recognize that health and well-being are critical to the stability and sustainability of our societies. And they want to do that by recognizing that health needs to be a core investment that we can use to build a more inclusive, just, and prosperous future. And it does that by trying to think about exactly the ways in which health contributes both to sustainability and stability, but also the way in which the political economy of the societies in which we live has a profound influence of the health of populations. And I think the evidence that's already been presented today really illuminates and illustrates that process. And the point here is that this moves in both directions, that we need to think about the way in which how we organize our economy affects well-being, affects health, but also the ways in which the health of populations affects economies more broadly. And I think Helen's work in particular shows that not attending to health has a direct consequence for both employees and employers, and that we need to recognize that there are co-benefits to addressing these kinds of structural and economic issues. Indeed, in my own work, we've tried repeatedly to focus on some of the ways in which the political economy of the societies in which we live affects health and well-being, by focusing on some of those macro determinants that Mary and Helen were talking about, and I think also came through kind of really clearly in Nico's work. So for example, we found that policies which improve labour market earnings improve health. Indeed, even relatively small increases for those at the bottom of the income distribution have a profound effect on health and well-being and mental health in particular. In fact, it's equivalent, small increases can be equivalent to prescribing people antidepressants, but don't have all of the kind of other benefits that come with that. We've found that contexts in which there is strong collective bargaining arrangements produce longer life expectancy and even reduce infant mortality, again, because of the way it protects workers in terms of improving working conditions, but also in terms of the ways that it improves earnings. Indeed, we found, and this I think again collects with a variety of other things that people have said today, that having strong social partners improves the health of those who are not currently in the labour market, that there are actually spillover benefits of strong unions, even for those who are not currently, and I stress currently, in the labour market. So for me, this leads to a set of reflections that I hope we'll think about what's the world that we want to kind of move towards. The first is that for me, we need to think about the ways in which we not just redistribute income, that we don't just redistribute the gains of economic growth, the gains of productivity to different parts of the labour market and different parts of society, though that is absolutely crucial. We also need to think about the ways that we redistribute power, because I think what's happened over the last 30 to 40 years is that we have eroded within many of our societies the power bases that created genuine negotiation, spaces for genuine negotiation between the different vested interests that we have within our societies. It's really clear that we've seen declining working conditions. We've seen increased precariousness. We've seen increased intensity, which has pushed people out of the labour market and created some of those inequalities that we've discussed. We've seen that many of the social and well-being externalities of harmful labour market practices have been pushed onto societies and individuals. And we've seen in recent months in particular, profit extraction in some sectors, which are actually exacerbating the kinds of insecurity that have already been created within the labour market. And so for me, what we really need to think about doing is how we can redistribute power so that we can create genuine negotiation and discussion between the different stakeholders within the economy to try and produce the kinds of well-being that people want to experience and that are the precondition for flourishing more broadly. So I'll stop there and look forward to further discussion with you all.
Thank you very much, Aaron, for your reflections. I'm looking at the audience. If you want to use the raise hand function, we are now taking your questions or comments. I'm also keeping an eye on the online chat Q&A box here. So anyone wanting to come? Otherwise, I'll go straight in. Okay. We've been talking about the regulatory teeth or the lack of them, and the fluffiness in terms of working conditions and what can be done at the EU level and what are the limitations at the national level. So if I would ask from you, Mary, first, who should take action here, and would you have one clear priority that you would now start addressing in terms of within the, let's say, the multiple challenges that we face in terms of the, let's say, the precariousness of work, psychosocial risks related to work intensity, the issues that we've discussed. So who should develop the teeth, and who would be the actors in combination, perhaps?
I think that one actor alone, but I think is not sufficient. But I think that there are emerging a number of actors, and I think that it'd be important that the trade union movement is involved with those. So as to kind of emphasize the role of employment, especially in the EU level, where actually trade unions have got a really special role, which many of the other actors don't have. They don't have the kind of a capacity. So there is a kind of a scope for engaging with the wider debates and to kind of presenting the wider case of employment conditions. And especially the kind of psychosocial well-being is, I think, to my mind, the kind of a good argument, because so much of the kind of occupational health and safety debates relate to the physical environment. And yet much of the kind of a future work is likely to kind of relate to the psychosocial determinants and psychosocial risks of work. So I think that might be one of the areas to engage with. But I think that to kind of, so in that sense, I think that there is a presence already at the EU level. And there are kind of this wide agenda, and I think it's reflected already in this meeting, to be honest, which is has got its focus on inequality and environmental policies. And so I think that is about to kind of create a common interest, which would be kind of about the societies which would have the well-being at the higher on the agenda of governments, which is not necessarily the case at the moment.
Thank you. I would ask Aaron and Nico both a question kind of following up from what Mary was saying. What do you see, or do you see, let's say, some initiatives, some policies, some movement towards more equality, specifically related to young workers, because they were highlighted as a specific group that is often exposed to, let's say, the new forms of work and the risks in the new forms of work, for example. So Nico, would you have anything to add to that first, and then Aaron?
You are absolutely right. We see that young workers share a high burden of those new risks. And we also see that the protection of young workers is not working. We did a study with Italian colleagues a couple of years ago. We looked at young workers, and we saw that even the basics, which is informing about risks, this is an absolutely basic legislation of workers' protection, is not done in young and precarious workers. And we see that for workers in the gig or platform economy. So we see, for instance, here in Germany, we got some indication of high injury risks in those who are running with a bicycle and delivering the meals. So I think that the young generation is facing particular high risks, but I don't see a big player who's really caring about that. But I'm not a policy researcher, so maybe Aaron has a much better view on that.
Thank you, Nico. I think that that's very interesting because in terms of addressing the issue, we of course we look at the data, but we also need to speak to the workers and approach them, because the workers are the ones who know their working conditions the best. So this is how we can actually we should involve them more. But Aaron, to you, do you have some even some examples from the WHO initiative of well-being economy, or in terms of the actors, who are the ones who need to act on this? Who are the ones who will move forward to the more equal world of work and world in general?
Yeah, thank you. I totally agree with what Mary has said earlier. I think the role of trade unions has a really crucial role to play here, and has been doing that. We've been working with people through the UK's Trade Union Congress who are really interested in these kinds of questions and thinking really hard about them. But I also think that there are other sorts of partners that have a vested interest here. I mean, the most obvious one is medical professionals and doctors. They care a lot about not just the individuals that they formally treat, but the people that they may eventually treat in the future. And they are also overburdened and stressed, and actually, I think, increasingly recognizing that part of the stress that they are experiencing in their work is part of the drive to create economic conditions that are actually pushing people into those GP surgeries who are kind of requiring this kind of help around psychosocial stresses, right? Like, though there is an increasing recognition, I think, that is an unsustainable way to organize both the production of our economy and the production of the health of our populations. And so I think there are certainly different kinds of organizations that have been involved in those conversations and could be brought into those dialogues to kind of work together to try and address some of these problems. So certainly we know that health systems across the European region are under pressure, and that actors are seeking to try and reduce some of those costs. And I think we've seen increasingly that firms and corporations have offset, as I said earlier, the costs of actually organizing our economy in this way to other sectors of the economy, including the health sector, and I think also pensions as well, because many of these things lead to early retirement. So, but there are examples. I think there are a number of places in which people have tried to think about how we reorganize our societies. And a lot of this is actually to do with financing models, that we actually want to think about creating resources to prioritize different kinds of services. We know that there's a kind of climate crisis which is coming, and we cannot avoid that. And so we have to think hard about how we're going to address that problem too. And so there are actors, I think, in that space that are also, I think, very willing to open conversations about this, because we know that the climate crisis will also exacerbate some of these psychosocial risks for many individuals. So places like New Zealand have tried to embed this more concretely, but we also have local examples, like in the north of England in the UK, where we have communities, local governments that have tried to embed community wealth building in terms of trying to think hard about how do we generate economic growth and retain some of that, the benefits of that within the communities that we have. And I think that's also a model that should be on the table for us to think through too. That's in Preston, to be more precise. So I think there are a couple of examples. There are other places that come to mind, but I've already talked too much, I think. But I think the point is that there are a number of different stakeholders who have a vested interest in improving improving the kind of working conditions of people, in reducing psychosocial stresses. And there are people who are trying to explore those models, and we should try to learn from those. Some will work, some won't, but that's okay. We need to just be exploring different options as we try to take this forward.
Thank you, Aaron. I think it sounds that there is a, let's say, a critical mass in terms of addressing the common problems, and then we'll need to pull that together. And the trade unions are very much at the heart of that and invited around the table, working on the issues in terms of inequality and striving for a change that has been the ethos, of course, since the start. I'm looking at the audience. Would anyone have any comments or questions? Yes, please.
Yes, good morning. I'm Tony Musu from ETUI, the Health and Safety Unit. I would like the panelists maybe to react to the first presentation that we heard this morning about the costs of psychosocial risks. So we've seen that they are huge. That of course the costs are borne mainly by workers. And my question to you is, do you think that this kind of study is a good way maybe to have the policymakers acting? Do you think that this kind of arguments are important in the debate to prevent psychosocial risks? Because as reminded by Hélène Sultan-Tayeb, of course, these risks are preventable.
Yes, Mary,
Yes.
would you like to? Yeah.
I think that there are good sides and then there are bad sides of that argument. And I think that we need to be clear about both sides of what you argue. Okay, because to some extent, it can make a kind of a issue visible. It can kind of show that this is the economic value, and that's been the traditional way to get things up front in the EU decision making their economic value now. But then you kind of also give in to the economic argument that these kind of symptoms are a problem because of the economic consequences, and that's the major part. It's not because of the lives lost. It's not because of the implications. Then the second line of that same argument is about if this is that much cost, then in terms of economic terms, how much cost would actually the personal smoking, the personal use of alcohol and other lifestyle factors provide? And in terms of comparison between the psychosocial stress, would the psychosocial stress be the major overarching one thing that we would need to work on? Or should we just work on more the behavioral other issues, which would be easily and addressed? So you kind of engage in the kind of a different policy discussions through the kind of emphasis on value, because you can value and you can put the monetary value on particular things, and you can nowadays do that. But I think that part of the kind of maybe the economy of well-being argument is that you also can kind of put the kind of economy accountable, that it should be accountable for well-being of the people, and what kind of would result in terms of the working places. So I think that there is both. We sometimes need to do that and to calculate it, but I would be quite careful in doing it in the EU context, just because that is kind of something that has been so much wanted in the EU prior, but in some sense what the EU needs to change in wanting for that only that can be counted in terms of costs can be kind of relevant for the EU activities, and I suppose that would be my kind of honest answer on this one. There is no scientific answer. There is no kind of other type, but I would be careful in and choosing my enemies, choosing my kind of focus in terms of, because it can bite back.
Thank you for the reflection, Helene. So moving on, would Aaron like to?
Yeah, I was just going to come in on that because I totally agree with the point that Mary said, and I also think there's also a sense in which, you know, to what extent is this persuasive? I think also, again, is partly conditional on how we think power is structured within our societies. Because actually, I think one of the key things is that large corporations have had a huge influence on the structure of economic policy, the creation of the conditions that actually have facilitated the trajectory that we're on in terms of precarious work is partly driven by a regulatory environment that facilitates and enables that to happen. And firms have been, and some firms in particular, have been a key driver of that. And I think Mary's discussion of the digital economy is really important for thinking about that kind of precariousness. So I think whether this stuff is persuasive is also about how we think power operates within our political systems. So yes, there's a sense in which Mary's exactly right that this kind of economistic logic is kind of certainly dominant and really important within this space. But it's also true, I think, that even within that discourse, there are some voices that matter more than others. And I think we need to think about how we redress those kinds of balances. There was also a question in the chat that I wanted to address about privatization. And I think there are real concerns here. In fact, we have a paper coming out just next week that shows how privatization in the NHS in the UK has led to a rise of treatable mortality. So this isn't just mortality rates in general, it's actually mortality that should be amenable to treatment if adequate quality care was offered. And that's using variation within the UK. And so I think we also need to think really carefully about the ways in which we're organizing those aspects of our economy and the kinds of partners and relationships that we want to develop and facilitate through how we organize these systems, because they can have very negative unintended consequences. And actually the promise of doing this in the UK context was that it would improve the quality of care. And at least according to our analysis, there's no evidence of that. Now, whether that's persuasive, again, I think goes back to the point that Mary was making before, but we think it's an important part of that conversation. So, yeah.
Thank you, Aaron. I'm hoping that you'll do a follow-up study also on how the privatization of health services impacts the working environment, the psychosocial risks and the working conditions, because I think that's a key, and we have evidence showing that those also deteriorate as a result of privatization. But Nico, would you also like to come in terms of Helene's study and the cost calculations? Maybe from your academic perspective, in terms of the evidence that you're working on large-scale studies, these kind of issues, the contribution of this kind of research, and what's your take on that?
I agree with the colleague from the audience that I think those studies who show costs related to certain exposures are important for the political debate. But I won't, from my own experience, I won't overrate their impact. We have such studies, for instance, for workplace health promotion. We always, when we try to convince companies to do this kind of health promotion, we always said, oh, your return on investment is XY. And that never does change anything. If a company doesn't want to do it, they won't. So, because in the moment the costs are socialized, so this burden of cardiovascular disease is socialized. It's carried by those who got the infarction and by the healthcare service. So so I think it's really important to do those calculations to get into this economic debate, but I won't overrate this. I think we also have to argue, that's what Aaron said. So we from the healthcare service, we have to argue it's bad for health, and we have to protect health without any cost, because for other diseases, we don't think about costs too. So I guess we should also very much focus on the medical argument. We know what makes people sick, and we know what to do against it. So let's do it.
Thank you, Nico. I think that's a pretty good wrap up of something. So we need to protect health. We need to protect workers' health against psychosocial risks, against all risks at work. That's also the legislation in the EU. Also, I'm picking up on the accountability there. So we need to make the economy accountable of well-being of people as well. So this is a wrap. We've pretty much spot on time. I would like to thank very much our panelists, presenters, audience here and online, and wishing you a good rest of the day. Thank you.